Kim Fortner. I'm going to make a short video to try to share the amazing story about the miracles that God has performed for our family with Brian recently. Some of my dearest friends have encouraged me to do that, mentioning that people are getting text messages here and there, but maybe not all of them, and just kind of if I could put it together in a video, it might really be helpful to somebody, especially with what's going on right now with everybody kind of shut up in their homes and not able to get out for church. So here goes. Brian was diagnosed with pancreatic cancer in October, so that's when this journey started. And just kind of to keep the video brief enough for it to be shared, I'll just kind of pick up with the surgery that he was told he had to have. The plan to treat pancreatic cancer was 3 months of chemo, followed by a surgery called the Whipple, and then once he was recovered from surgery, another 3 months of chemo. And so he's had his 3 months of chemo, and his surgery was scheduled for Tuesday, March 31st. We'd been told, as far as the Whipple surgery was concerned, that it was as major and serious as it gets. The surgery itself would take 4 to 12 hours on average to just perform the operation. Generally, a Whipple involves removing part of the patient's stomach. It can be a great part of the stomach, a majority of the liver, the pancreas, the small bowel, the bile duct, if the person still has their gallbladder, the gallbladder. Doing all of that, they're working around critical veins and arteries. They told us heavy bleeding is anticipated. Strongly encouraged Brian to accept a transfusion, and that they would have blood matched and cross-matched and in the cooler for him during the operation. We came down, of course, for his surgery on Tuesday. The doctor came by that morning to do the last, do you have any questions before surgery? Have you been told everything you feel like you need to know? And this was a resident that scrubs in and is training to perform the Whipple operation. And he said to Brian then, he said, so I trust that you've been told, how all of this works. You'll have 8 to 12 weeks of recovery. The recovery is going to be a long, hard road, but you can do it. It's been done. And being in the hospital, he said, once your surgery's done, you can expect to be in the hospital. And Brian said, I know, they've told me over and over and over, I'm going to be in the hospital at least 10 days and probably 20. He said, but I'm just going to tell you, Doc, I'm not planning on being here that long. And so this resident told Brian, he said, well, Mr. Fortner, I'll tell you, if the surgery went perfectly, and he said that just never happens. These are complicated surgeries. Remember, 4, which we're kind of thinking yours will probably take 4 hours, thereabouts. But he said some of these, and we don't know until we get in there, can go 6, 8, 10, upwards of 12 hours. But he said, let's just go with surgery goes perfectly, move to ICU, everything there goes as well as it possibly can, and you're moved to the floor and continues to go well, you might go home in 7 days. But don't anticipate that, because that's just not how these things go. And so it was clear that he was trying to tell Brian, I know you have a plan to beat the timeline, but it just doesn't happen. So they finally got started with Brian's surgery on Tuesday. They called from the operating room to let me know it had began, and that they said it was at 12:15. At 2:15, with the hand on the clock laying right on the 3, exactly 2:15, the lady from the information desk come to tell me that the surgical nurse had asked her to relay that Dr. Thompson felt like he would be able to wrap up Brian's surgery in about 45 minutes. So it's 2 hours and 45 minutes. So I'm watching the clock, I'm counting, I'm recounting. And, you know, I guess I should be embarrassed to admit, but I mean, it's just how things have been in my experience with about everything we've ever been faced with my whole life, which is that I'm thinking, wow, that's great. That's not 4 hours. That's great. Immediately followed, and actually, you know how your brain works, it's kind of at the same time, uh-oh, that can't be good. They must have opened him up, and they've just had to close him up, and that's not going to be good. And so, you know, as I've always had to do, I'm fighting that, trying to fight it with all that I've got. And so I decide one of the things I could do to try to get ahead of that and be positive and act on my faith, you know, faith without works. So I get my phone and I start texting his family, because no one could be there. You know, it's COVID-19 season, and it was a push and a struggle, and I felt like only prayer that got me in the waiting room, because I'd been told when we got to the door of the hospital on Monday that I wouldn't even be able to come in. But at this point, they had let me in, and I was to be there with him just until the surgery was completed. So Margie, Shannon, none of the rest of the family was there. So I get my phone to text them. They say they'll be done in 45 minutes. This has got to be great. So I'm trying to believe that. Dr. Thompson comes out. It's time to give me the report. And as soon as I see Dr. Thompson coming to the room, I told him, I said, you know, I don't mind telling you, Dr. Thompson, when that lady come to give me a report 2 hours in, I was like, it was either not good or it was terrific. And as I began to get out the word terrific, Dr. Thompson, who is, and I'm sure it's required by the nature of his job, but he's not a smiler. He's a, you know, matter of fact, calm, collected, you know, I'm sure with the intentions of not giving false hope. But this time, he spoke over me as I'm trying to say terrific, and he said, terrific. It went terrific. And then he began to sit down, and I said, tell me about it. And he said, I'd love to. He said, I don't mind telling you, Ms. Fortner, I have not had a surgery. And he paused, you know, as if to reflect. And he said, I haven't had a surgery go that perfectly in a very long time. He said it could not have gone better. And he proceeded to tell me that they removed the smallest part of his stomach, the smallest part of his small bowel. They removed none of his liver, which is not common. They removed only the head of his pancreas, not common in that kind of surgery. And they removed his bile duct. If I didn't mention to you, also as they talked to us in every one of the pre-op discussions since October about this surgery, he said one of the things that makes it extremely complicated, risky, dangerous, hard for the patient is when what has to be removed is removed, and things have to be, you know, reworked, replumbed, re-engineered, however you'd say that, particularly in a certain section, which I think kind of was over in the pancreatic area, but either nurses and what have you would know, but he said it's like stitching into cornbread, which, I mean, just seems impossible to me. But Dr. Thompson even commented specifically about that, and he said, you know, he said, do you remember me telling you about how we'd have to kind of stitch into cornbread, and that gets kind of tricky? And I said, yes, sir. He said, Brian had great tissue. He said, it wasn't a problem. He said, I'm so happy to give you such good news. And then, you know, he kind of concluded. He said, of course, you know, I'll be giving you updates, and I'm so sorry that you're not going to be able to see him. Well, doctor, and I wanted you to hear that, to know that's how things changed, how quickly things changed. It continued to look obvious. It had been said. There was no question. I would not get to see Brian. There's the surgeon who's just completed the surgery, and by the way, his residents had referred to him as a bigwig at the hospital, telling me, I'm sorry you can't see him. Lady came from the information desk. They had called down from another floor. She said, I know that I just told you that you wouldn't be able to see your husband and that you'd have to leave after Dr. Thompson gave you the report. But they've called. Don't really have a why. But they're going to let you see him in the ICU, maybe 20, 30 minutes, long enough for you to lay eyes on him and know, that he's okay. And then you'll be asked to leave. So I was thrilled with that. And I'm like, wow, all these people are still praying. And not only had I gotten a great report from Dr. Thompson, but being able to be with him and see him for not only my, but his benefit too. I mean, that was a big deal. And right there, literally 11th hour, you're going to get to go see him. And I did. I went back to the ICU. I'm not sure he even remembers seeing me. I haven't asked him yet, but I got back there, and it wasn't the most pleasant scene ever. They put in a central line, an arterial line, his port. He had 2 drain tubes on his left side. He had 2 additional tubes for other drainage on his right side. But his color looked good, and he was resting. Sorry about that. So I just sat in a chair at the foot of his bed, and in a little while, the ICU nurse came in. And even when she came in, she wasn't like doing something for Brian or anything. She just kind of walked there at the foot of his bed, and she said, "You're his designated visitor, Kim Fortner." I said, "Yes, ma'am, I'm his wife." And she said, "Okay." She said, "I kind of assumed, but I didn't know." She said, "I was just down there talking to them at the desk," and I was like, "Would y'all look in there to that room?" Because they had put him in a room that purposefully was positioned across from the central desk so he could leave his door open and have eyes into that room at all times. And she went on to say that she'd been telling them out at the front desk to look in there at his room at how he was resting. And she said, and I said, "Oh, really?" And she said, "Yeah." She said, "You cannot imagine at this point with a patient who's had a Whipple. They're hollering, they're moaning, they're groaning." She said, "They're in so much pain." And she said, "Understandably so." She said, "I know they've told y'all how invasive and extensive a procedure this is." She said, heart patient, they work with the heart and some veins and arteries, but she said they've worked with his liver, his stomach, his pancreas. They've removed a bile duct, his small bowel. She said, they're not looking at them and touching them, but they've taken them out, cut them off, put them back. She said, it's major. She said, "He's just resting, and you're just sitting here watching him rest." She said, "Usually the patient's taken on, the family's taken on, one upsets the other." She said, "Usually this is a very, horrific scene. It's just, these are hard patients to care for." She said, "They're all wondering how I got him." She said, this is amazing." She said, "We're going to call him the superstar Whipple patient." And if those of you who heard stories from his chemo, that wasn't my word, that was hers. And yes, different nurses, different doctors, different days and times and places used similar and sometimes the same word talking about how Brian did through his chemo. So, about to run out of time, but the most important great news that followed that was when Dr. Thompson called to give me the pathology report that said they removed the tumor, of course, sent everything out to the lab. The report confirmed that Brian's was stage 1. There was no cancer in his lymph nodes, and his tumor, all that was remaining of it, was 7 millimeters, which is about the size of a dried up pinto. And what you should know about that is that's what Brian and I said at home. We hoped it'd be shriveled up to exactly that size when they got in there. That's what God's done for us just lately.